Hello everyone. As a part of pre-workshop learning for the Dialysis Technician Update 2024, which is to be held on 7th April 2024, I, Dr. Manoj Dhanorkar, Assistant Professor, Department of Nephrology, AIIMS Nagpur. Today I am going to discuss with you regarding hand hygiene and use of personal protective equipments. The objectives of my presentations are understanding the pathogens and the modes of infection, the infection path, prevention of infection, how to use hand rubs and hand washes, and a personal protective equipments. So what is infection? Infections are caused by pathogens or germs which are frequently found around everywhere. These germs, when get entered into the body, cause illness, tissue damage, or a disease called sepsis. Our human body has developed a natural defense mechanism to protect against these pathogens called immune system, which fights against these pathogens. The common pathogens that are found include bacteria, viruses, fungi, and parasites. A bloodstream infection is an important aspect in a dialysis patient. Bloodstream infections, when developed, can cause a death in 1 out of 4 patients. During the infection, patients become sick. They tend to have, there is an increased cost of treatment, and they may develop complications related to the infections in the form of infection of the heart called endocarditis and infection of the bone called osteomyelitis. Also, that these infections require a very long-term use of antibiotics, which can further pose many other threats, including the risk of antibiotic resistance. So, before we vouch on to the prevention of infection, one must know how the infections spread to a dialysis patient. So, infection path is a path of an infection or a route or sequence of events that are taken by the infectious agent to make a person sick. So we have an infection agent which is there in some or other form of reservoir, goes from that reservoir through a portal of exit, gets transmitted via various modes, and gains an entry into the susceptible host, in our case the dialysis patient, through various ports of entry causing infection. So the infection agent that are very commonly seen in our dialysis patients are the bacteria and viruses. Bacteria are predominantly responsible for the bloodstream infections, which are serious enough to cause death, and these are commonly called sepsis. Bacteria commonly involved in dialysis patients are Staphylococcus species and the Enterobacteriaceae. Viral infections are commonly seen in, some of the viral infections are commonly seen in dialysis patients like hepatitis B, hepatitis C and HIV, which spreads through the infected blood or body fluids, while some viruses like influenza, rhinoviruses, coronaviruses, they spread by the respiratory virus particles. Now coming on to the reservoir part. So reservoir means that the infectious agent normally lives in that particular place and undergoes multiplications. So there are various reservoirs like humans, animals or insects, or environmental reservoirs. In dialysis patients, environmental reservoirs play a key role in the path of infection. Many environmental surfaces like dialysis machines and equipments that are there around the patient are responsible for the further process of dissemination of infection. Also, that there is a lot of water used in the patient environment, which is also where also the pathogens can thrive. So the first thing that occurs during the process of infection is the portal of exit, that the infectious agent or pathogen leaves the reservoir, and the modes of exit includes predominantly four: respiratory, gastrointestinal, blood, or skin. For example, if a person harbors an infectious agent in his throat and he develops a sneeze in a crowded dialysis unit, the pathogen can exit from that reservoir through the respiratory tract. And if in that scenario the person does not cover his mouth during the sneeze, the droplets of those infectious pathogen would spread around and deposit onto many surfaces in and around that person. This way the pathogen will found a way for his exit from the reservoir. Now, modes of transmission. Once exited, the pathogen then moves from one place or an object or a person to another place, object, or a person. So various types of pathogen takes various modes of transmission, and they can take more than one route also. The transmission could be direct transmission or an indirect transmission, or it can be in the form of droplets or airborne or fecal-oral. Sometimes it can be abiotic environmental factors responsible for the transfer. In dialysis patients, contact transmission in the form of direct or indirect is one of the important source of modes of transmission for these pathogens. Now, portal of entry. So once transmitted, now the pathogen have to enter into the new reservoir in the form of either a new dialysis patient. So like the portal of entry, there are various entry points for the pathogen to like respiratory tract, gastrointestinal tract, blood, and skin. In our patient, majority of them undergo some form of dialysis through invasive lines or needles, and when these pathogens they deposit onto the skin, while these needling processes they get an entry to the pathogens get the entry into the dialysis patients. Now last part is the susceptible host. Our dialysis patients are definitely the susceptible host because they have a weak immune system. They receive treatment very close to many other patients. They frequently require hospital stays and multiple surgeries during dialysis, and they also need to undergo frequent accesses to bloodstream infections. So if we look at the type of access that is used, the susceptible host can have an increased risk of infection if the dialysis access is a central venous catheter as compared to a fistula where the risk of infection is less. So now understanding the spread of infection, one must protect from getting infection. So infection prevention involves the group of practices called standard precautions. So these standard precautions are meant based on the type of germ or pathogen that is found in the particular reservoir. So the reservoir could be blood, it could be secretions or body fluids, excretions, non-intact skin or a mucous membrane. So when we say a contamination, that the germ or pathogen has got entry onto the surface or into the equipment, and that is the time when aseptic techniques are very much required, which prevent this spread of germs on these surfaces or equipments. So important part for that aseptic techniques is one important one is the hand hygiene. When we say hand hygiene, it includes both cleaning of the hands either by washing the hands with soap and water or with the antiseptic hand wash, antiseptic hand rubs, or surgical hand antisepsis. And this is found to be the most effective method to stop the spread of the pathogen. The spread of pathogen could be to yourself, like the dialysis technicians per se, or to the patients or multiple surfaces. It could be between the two dirty body sides like two wounds, or it could be to the clean side from a dirty side, such as they can access on a particular dialysis patient. So hand hygiene in dialysis facility can be performed either by alcohol based hand rubs called ABHR, or by washing the hands with soap and water. So using hand rub, using alcohol-based hand rub is one of the preferred and best method for hand hygiene in most of the clinical scenarios, because it is readily available and it is known to reduce the number of pathogens on your hands. These hand rubs are available in the form of liquid gels or foams, and they need to be applied as much often as needed, and there is no need to wash hands with soap and water even after several uses of these alcohol based hand rubs. One has to put or apply a proper amount of product on one hand and rub the product between the two surfaces until it gets dry, and the process usually takes around 20 seconds. So as has been depicted in the figure, one must take a palm full of product or that liquid into the cupped hand, and it should cover all the surfaces. Then rub the palm of one hand onto the other. One can rub the dorsum of the one hand with the help of the other hand, and one must interlace the fingers also. The same should be done on the palm side with finger interlacing. Then the back of the hands should be opposed onto the palms of the other hand with fingers interlocked to clean the tip part of the fingers. Then rotational rubbing of the left hand onto the by clasping in the right palm should be done to clean the thumb area. Finally, rotational rubbing, backward and forward movement of the clasped fingers of one hand onto the other should be done to finally clean the tips of the hand, so that one can say that the hands are completely clean. Hand wash using soap and water is preferred when the hands are visibly dirty, or if the person has used a restroom, if the person is going for handling or eating the food, or if there is a buildup of residue on the hands after several uses of these alcohol based hand rubs. So to do this, one need to wet the hands with the water. Then one must apply enough amount of soap on all the surface of the hand. One must start rubbing the hand palm to palm, then palm over the left dorsum of the other hand. After that, during this procedure, one must interlace the fingers also, then palm to palm with fingers interlaced. After that, back of the fingers on the opposing palms with fingers interlocked. Finally, rotational rubbing of the one thumb while clasping the thumb on the other hand, and vice versa. Then rotational rubbing, backward and forward movement with clasped fingers of one hand on the palm of the other hand in vice versa direction. And finally, rinsing the hand with water. The rubbing hand usually requires at least 15 seconds, and the entire process requires around 40 to 60 seconds to perform. One can dry the hands thoroughly using a single-use towel and close the water supply. Using hand lotions is one of the component, because of the frequent hand hygiene is responsible for dry and irritation of the skin. Hand lotions prevent skin dryness and irritation, but one must use only hospital approved hand lotions, because if not approved, they can actually cause hand hygiene less effective. They can cause breakdown of the latex gloves, and they themselves can become contaminated with the bacteria. So when a person is supposed to do hand hygiene, there are 5 important aspects of doing the hand hygiene. First, before touching the patient, like prior entering the patient station or prior performing any patient care, or prior to contact with patient access site, whether it is fistula, graft or catheter. Secondly, before a clean aseptic precaution, like prior any cannulation, prior any accessing the catheter, or prior to medication preparation or medication administration. Now, after the body fluid exposure, body fluids in the form of blood or a spent dialysate, or exposure to dialyzer tubings or priming buckets, or any wound care or dressing changes. Even after touching the patient, like any performing patient care, any adjustment of the cannula needles or catheters, or even after removing the gloves. And finally, even after touching any surrounding. This surrounding includes not only the dialysis machine, but also other items like dialysis stations in the form of patient chair, television, any fistula clamps like that. So what is more important in hand hygiene is that it is the most important step in preventing the infection by getting rid of germs and avoiding the spread of germs. Doing hand hygiene either with in the form of alcohol based hand rubs or by using soap water is equally beneficial. When you clean your hands, that's the most important thing. Putting a new pair of gloves does not replace the need for doing hand hygiene. Now coming on to the personal protective equipment as a standard precaution measure. Now personal protective equipments differ by the situation and setting a person is going to work. So it depends on the anticipated potential exposure that a dialysis technician or any healthcare person is going to get exposed, based on which the personal protective equipment should be chosen. A personal protective equipment generally includes a protective clothing, gowns, gloves, face shields, goggles, face masks, respirators and other equipments. So personal protective equipments are basically meant to protect you, the healthcare personals. So in those components, gowns, they are to be used by the dialysis staff while caring for the patient within the treatment floors. So when all situations those should be worn: one, initiation and termination of dialysis, while manipulating any dialysis access, administrating or delivering any medication including heparin and saline, reprocessing of the dialyzers, and cleaning or disinfecting any patient care supplies and equipment. The gowns need to be removed immediately if found soiled with blood, any body fluids, secretions or excretions, or on a specific schedule. So while wearing gowns, the gowns of type open back gown type, open back type gowns, one can put their arms in the sleeves of those gowns. Then they can pull over the gown over the head. Finally, they can tie the gown on the back at the level of waist. While doffing the gown, one must pull the gown forward with both the hands both the hands breaking away the gown at the back, neck and the waist level. Then the gown should be pulled forward in front of away from the body, and then it should be rolled in a ball-like fashion to contain the fluids or any contamination into it, and then finally it should be disposed of. Now coming on to the gloves. Now these should be used when there is an anticipation that one is going to touch the patient or any patient's equipment. Patient's equipment, the patient or patient equipment in the form of carrying the access site, insertion or removal of the needle, giving any intravenous medications like heparin or saline, or handling the patient's catheter. One must wash their hand or clean their hands before using gloves. You must remove the gloves and then clean your hand between each two patients or any patient stations, or if you are moving from a dirty area to a clean area, like when you are removing the used catheter dressing, which is considered dirty, and if you are moving to the next area of cleanliness, you must remove the gloves. So while for wearing the gloves, one can open the gloves from a non-sterile margins. Then one must hold the gloves with the help of cuff of the one hand and pass the hand from pass the other hand into the gloves. While passing the second glove, one should avoid holding the glove from the cuff side, and it should be held from the inner side of the cuff, and the hand should be passed through the second hand should be passed from the second glove. This way you can nicely wear the gloves without causing any surface touching of the gloves. While removing, one must remember that when both the gloves are on, one must hold the first glove with the help of the other hand and pull it forward. Then pull off the glove, turning it inside out. After that, a ball of the removed glove should be held onto the gloved hand. Then, with the help of non-gloved finger, it should be slide under the cuff of the second glove, and then the glove should be pulled off, covering the removed previous glove. And both then should be disposed of in a proper way. The third important part of PPE or personal protection is the face protection. This can be done with the help of a face shield or the mask with goggles, and they are meant to protect your mouth, nose and eyes. So they should be worn while performing procedures where there is a risk of spurting or spattering of the blood or other fluids. The procedures like initiation or termination of dialysis, manipulation of access needles or catheters, administration of medicines through extracorporeal circuit or by subcutaneous injection, reprocessing of dialyzers or any centrifugation of blood, and cleaning and disinfecting patient care supplies and equipments. The face protection should be removed immediately if found soiled. For removing the goggles or face shields, one must grasp the ear or the headpiece with ungloved hands. Lift that face shield away from the face and then place it in the designated receptacle or reprocessing unit or for the disposal. So one must remember for PPE that the PPE such as gown, gloves, face protection should be worn according to the exposure a person anticipates the kind of infection, and facility protocols should be established for discarding them, cleaning them and laundering the personal protective equipments. Removing gloves and performing hand hygiene between each patient and between each patient stations is very important, and one must change the gloves whenever they are going to perform a procedure which moves from dirty to clean area.